The following audio-supported podcast is intended for informational and educational purposes only and is not intended as medical advice. Please speak with your healthcare professional before making any treatment decisions. The guests on today's show were paid to participate in this podcast. The information provided in this podcast is current as of the date of recording. The opinions of Dr. Sue are solely her own and do not represent the opinions of any other entities.
What's up, Cheat Codes listeners? It's me, Dr. Z.
And me, Dr. C.
Dr. C, we have spent a little bit of time highlighting superstars, rising stars in sickle cell disease through Cheat Codes, but we haven't done one of these episodes in a while.
Yeah, these are fun. I think the audience gets to meet people who they're going to hear a lot from in the future, and it's fun for us to talk to these rising stars. And we have a great one today. I'm really excited.
Yeah, absolutely. And it's clear that the foundation that was laid by the legends is obviously huge and important, but getting to the promised land in sickle cell disease is going to be on the backs of all these rising stars.
For sure.
So with that, are you ready to jump into our episode today?
Let's do it.
Cheat Codes listeners, for you who may not know, the rising star with us today hails from a Midwest city, Dr. C.
Yeah, she's working in one now anyway.
We're going to find out where she came from, how she got to where she is, but right now in the Midwest, in Pittsburgh, we've got with us Dr. Julia Shu.
Welcome, Julia.
Julia, welcome to Cheat Codes.
Thank you. It's a pleasure to be here.
I have so many questions for you. I feel like I've known you for the last few years, and we've definitely spent some time together working on various things, but I realize we have not spent a lot of time diving into actually who you are and what your path has been, and I'm so excited to hear from you today.
I'm really honored to be here with you and Dr. C, Dr. Z. You've really had some incredible people on this show, really amazing stories and career paths and just experiences. And so I'm very honored to be a part of that group.
Agios is a biopharmaceutical company that's fueled by connections with patient communities, healthcare professionals, partners, and each other. Building on these connections and the company's unmatched leadership in PK activation, Agios is pioneering therapies for rare blood disorders, including sickle cell disease, thalassemia, and PK deficiency. To learn more, visit us at agios.com. That's agios.com. To join the conversation with other patient allies, follow us on Instagram at Ally Voices Rising.
So Julia, let's start right at the beginning. Where did you grow up?
Yeah, so I grew up in Omaha, Nebraska, and back then, Omaha, Nebraska was very Midwest, very, I would say, typical white, suburban, not a lot of Chinese people. My parents are from China, and so I grew up as a typical middle America kid. And for whatever reason, just was always really interested in learning about the rest of the world. And as soon as I got a chance to travel and get out there on my own for college, I ended up moving to the East Coast. I did college in Philadelphia and then medical school in New York, studied abroad in Argentina, and then went on to do medical research in Peru and Dominican Republic. And from there began to work in global health. And ultimately that led me to sickle cell.
Wow, that's quite a route. That's a very international route to sickle cell. I have just a million questions though now. Is there a moment in this course, let's stay in Omaha, Nebraska for a second, where you were like, I think I want to be a doctor. I think this is it for me. How early in your life does that moment hit you?
It's hard for me to pinpoint a moment because as the kid of immigrant parents, I've been told since I was a baby that I was going to be a doctor. And to parents who were doctors back in China, I've been exposed to medicine all my life, and growing up was always curious about medicine, the human body, I always really liked the sciences. So I always gravitated towards there. And probably starting in high school when I started having a chance to volunteer in the hospital and interact with patients and families was when I really started getting interested in the patient aspect of medicine. I really loved being with patients and being able to provide comfort in those really difficult moments. And I can't change everything, but if I can just help out even a little, I felt like I was doing something and contributing. And that's what I wanted to do. I wanted to make those small differences. And eventually, as I began to think about what I wanted to do with my life, what drove me, I wanted to make bigger and bigger differences in my patients' lives and pivoted more towards doing both clinical medicine and research.
I love that. That resonates with me so deeply because also as the child of immigrant parents, your opportunities to explore alternate careers outside of medicine and really law and maybe engineering are very limited. So I felt that. I totally felt that. Omaha, Nebraska, I've just got to ask this. You alluded to it as a daughter of Chinese immigrants. I'm curious, that was probably very hard, right? And probably you had some experiences that were quite tough in terms of being in a community where you're a really big minority. And the reason I ask this, Julia, is because I feel like that plays into sort of the sickle cell story long term, right? I'm curious to hear, is that experience, am I wrong, or did you certainly feel some of those experiences?
I think you're right. I certainly think there are some commonalities to minority experiences and immigrant experiences in terms of being more marginalized, not necessarily having the same amount of access or respect or resources as maybe the usual majority. Two types of experiences shape somewhat of who I became. One was being an immigrant where I actually emigrated from China when I was 7. So I was actually born and raised initially in China, and then I moved to Nebraska when I was 7, and I didn't speak a word of English. And
So challenging.
it was just a confusing time. But these vague memories of being in classes for students who didn't know English, ESL, like English as a second language classes, and not being able to communicate with my teachers. And one of the defining things that I tell as a party joke now, but really isn't funny from a racial perspective, is when I was in 2nd grade, my teachers didn't know how to pronounce my Chinese name. So they sent me home with a list of American names for my parents to choose from so that they could sort of call me an American name in school. And so my parents chose Julia because they knew Julia Roberts. And that's how I became Julia.
Wow.
That was a good choice.
I don't mind it. Personally, if I had chosen my own name, I would have chosen Lily, which is what I ended up naming my daughter.
Cute.
Yeah, but they made a choice, and it's cute, but also terrible that they did that. And so then moving forward, it was just always easier for me to be referred to as Julia, and to the point where I started recognizing that when my patients saw my name, they immediately had an interpretation and reaction of what they expected me to be as their doctor. And the reaction was more positive to my American name. So before I got my formal medical license, I actually legally changed my name to Julia so that this would not be a barrier for me in the future. But it was a struggle to set that part of my cultural identity aside and say, okay, I'm going to make the conscious decision to assimilate because that's what I need to do to be successful in the society. And I can definitely relate to the experience of not being accepted for who you are, not being understood, and having a lot of preconceptions around your identity that you end up having to protect yourself against. And I talk about this with especially my younger patients who transition sometimes. I know who you are, but the emergency room doctor who sees you may not. And unfortunately, because of the way our healthcare system is set up, they may have preconceived notions about you. And I know a lot of our warriors will dress up or up before they go to the emergency room because they want to present themselves in a way that they see themselves and not in the way that society is setting them up to be seen, which is really unfair.
Like just to get a fair shot, right?
Yeah. Yeah.
Wow.
It's great in a lot of ways, but definitely challenging for minorities in more ways than one, and definitely from different perspectives.
Wow. I got goosebumps actually as you were talking about having to put aside your identity for a little bit of acceptance. And I think those sort of core events in your life really shape ultimately who you become. And I think that now this is a story I've never heard from you, but I think it really makes sense knowing who you are and how you approach the work that you do. It's really grounding in your story. So let's continue the arc forward. So you go through from Omaha, Nebraska, you end up in college.
Yep. So I went to University of Pennsylvania in Philly.
Very cool. So you go to University of Pennsylvania. How's that experience? That's a pretty good school.
It's a cool place with Ben Franklin and a beautiful campus in the city.
No, it was a wonderful experience. First of all, living in really great city. I loved it. It's a very cosmopolitan environment. There's a lot of people from lots of different backgrounds, just a much more diverse group of people than what I was used to in Nebraska. And it was honestly really nice living in West Philadelphia. I think later I realized that I am drawn to environments where I'm able to live where I work in a sense. It's helpful for me to see the environment where my patients live and kind of have their daily experience because it helps me better understand their experience, like their daily experience. So I think I really enjoyed living in West Philly, and the hospital is such a incredible hospital with their pediatric program. It's really well known for sickle cell and among other things. I did a lot of work volunteering in their hospital.
Were you interested in sickle cell at that point?
Not at that point. I actually did some emergency medicine research and some work using simulations to train critical care and emergency physicians, like first responders, to handle challenging situations.
Like medically challenging or socially challenging?
It was medically challenging.
Very interesting. So this is college. So you're getting a really good experience pretty early in your academic career here.
I wanted to get exposed to clinical medicine. I wanted to get a sense of clinical research. And then I've always been drawn to trying to help in disadvantaged communities. And so there's a Philadelphia Chinatown free clinic. And so I volunteered there as a Mandarin and Spanish interpreter because I speak Spanish as well and did a Spanish major. And I got certified as an interpreter in the hospital and at this free clinic. And then on the scientific side, I was pursuing basic science research. I crammed a lot into my 4 years at Penn. I double major in biochemistry and Spanish and did a master's in chemistry and basically
Oh my.
I was doing a lot of basic science research, looking at signaling for angiogenesis. So basically looking at how to grow new blood vessels into tissues, which actually becomes pretty relevant for my area of research now, looking at blood flow in tissues and sickle cell. And then I was at the same time pursuing this humanities degree in Spanish because part of my brain really loved the basic science, but when I needed kind of a break from the basic sciences, I really loved to dig into Spanish literature.
Wow. You have this girl from Omaha, Nebraska, first time in a big city, really, East Coast, with a lot on your plate. Man, that probably took a lot of determination and fortitude to stay on track, to fit all that into your weekly schedule. That doesn't sound like an easy thing to go through.
Yeah, it was a lot of work. I would say I've always been somewhat of a planner, and I tend to look forwards towards a goal and make a plan for myself and put together a roadmap of how I want to get there. And I think the biggest lesson I've learned along the way is that you just have to be as flexible as possible and enjoy the journey, because it can be completely circuitous, but still completely rewarding. But at the very least, having a plan in mind is nice to at least guide your way.
Yeah, absolutely. I can very confidently say that sickle cell was probably not on your roadmap when you first created it in college. But I'm curious at what point it makes its first appearance.
It got on my roadmap in medical school. So I think it was a combination of a few things. Like the groundwork was definitely laid in college because I had this interest in basic science and human physiology in terms of blood flow and blood. And I was also really interested in global work with the interest in Spanish. And so when I went to Columbia for medical school, I didn't realize how perfect of a fit it was for me. But Columbia University is located in Washington Heights in Manhattan, and it's a amazing Latino neighborhood, predominantly Dominican. And I got to help run our medical student run free clinic where I was able to use my Spanish. I ended up taking a research year during medical school to go work in the Dominican Republic. And during medical school, because I got further interested in hematology, I pursued something in hematology that was international. So I happened to connect with my mentor, Steve Spitelnik, who does transfusion medicine, but also works in hemoglobin disorders and red blood cell disorders. And they do some work with sickle cell and other hemoglobin disorders, but a lot of work focusing on G6PD deficiency. So I actually went to the Dominican Republic to study G6PD deficiency and then did a side project on sickle cell disease. And then while I was there, just got more and more interested. I found that there was a pretty high prevalence of sickle cell trait in the population I was working with. I found that a lot of people knew the term for sickle cell disease, thalassemia, but they really didn't know very much about it. But that teachers could tell that their undiagnosed students in class probably had the disease because they would have pain in school, they would miss classes all the time because of hospitalizations, but they didn't have newborn screening. They didn't really have confirmatory diagnosis and really not options for treatment and monitoring for the disease in the Dominican Republic, even though it was pretty prevalent. And then my mentor supported me to go to the American Society of Hematology meeting for the first time as a medical student. And I happened to stumble upon one of the global sickle cell meetings that Isaac Odame runs. And there were some amazing people there, Louis Hsu and Russell Ware, etc. And I happened to meet some of these big leaders in sickle cell we've had on the show. And they were just all inspirational, and everyone was so dedicated and such an advocate for sickle cell. And it was such an incredible community that I was enamored. I felt immediately drawn and connected to this community that cared so much about their patients and making a difference for patients around the world, and really try to change the story of sickle cell for people, especially living in lower middle income countries. And I think it just clicked, and it really engaged like all areas of my interest. And starting from there, I really never looked back.
That was it. You went to that meeting at ASH and you were like, this is my tribe. This is what I'm going to do.
Absolutely. I found my tribe when that's what I do.
That's fantastic. So, and that was what year in med school?
2012.
And were you presenting like your G6PD stuff? It was something about HIV clinics, patients with G6PD having drug side effects.
Yeah, that's right. So basically, there was not a study before mine that looked at the prevalence of G6PD deficiency in the Dominican Republic, but one of my mentors had funded an HIV clinic, and they had lots of patients with anemia who were on, for instance, AZT, which is known to produce hemolytic anemia. And sometimes they would have patients who have sudden episodes of hemolysis, drop their hemoglobins very low, and they don't have great access to blood transfusions, so it could be life-threatening. And we thought, it would make a lot of sense to see if we could come up with a way to screen for G6PD deficiency in this population. So I did the first epidemiological study, found about a 9% prevalence of G6PD deficiency in the population, and did genetic testing to see what type of variants were in that population, and then combined that with a questionnaire, like a simple questionnaire that providers could administer so that when we put it in an algorithm, you can actually increase the sensitivity and specificity of the quick color changing test that typically is not very good for diagnosis, but make it a better test for low-income settings that we hoped would be able to help improve diagnostic capacity in these low-resource settings.
I feel like most of the med students I worked with had trouble learning to write a note or something, but you're off developing new tests for rare genetic diseases in international countries. That's amazing.
I definitely got very lucky to have had the opportunity and the mentorship. And also, I wasn't planning to initially take the year off, but when I saw the need, it's a rare, but not really rare disease. It's just under-recognized and underdiagnosed, and it potentially could make an impact. I was like, oh gosh, this is my chance to potentially make a difference. I think this deserves a year of my time. I should do it. And yeah, did it.
The thing about sickle cell disease is that once you take your first step, it's almost as though every one step you take forward, they pull you in another 100. And by they, I mean that tribe that we talked about. I know your tribe, as you get to residency and fellowship, continues to grow, and you run into some pretty legendary and impressive people along the way. Walk us through your sickle cell family as you're learning about sickle cell disease, who they were and how they influenced you along the way. I'd love to hear that.
Oh, wow. Yeah, absolutely. I think probably the first person I worked with specifically for sickle cell disease was Marilyn Tellen. For residency, I decided to go to Duke University for a few reasons. One was that I met Nirmish Shah at ASH, and he is at Duke and was awesome. And I was thinking about doing.
He might be the best advertisement for Duke that exists, truly. Once you meet a guy like that, it's like, I want to be where he is, around him all the time.
He's just so charismatic and brilliant and so easy to just get inspired by. I was trying to decide on whether to do medicine and pediatric training, because if you're going to work in global health, it's really helpful, especially if you're taking care of sickle cell patients, to be able to take care of kids, since so many of those diagnosed abroad are children. And since he had a medicine pediatrics background, I talked with him extensively about it. And then in the end, decided to do a different kind of combined training program, because when I took a look at Duke, I realized that they had a internal medicine global health training program where you do a 4-year program of internal medicine residency, a master's in global health, like a master's in public health, but focused on global health. And then they give you 1 year of time to work internationally doing international research. And it's pretty rare during your clinical training to be able to get this protected time for research. So I thought this was a fantastic opportunity, and partly decided to go to Duke because I love the program, partly because I wanted to have this global health training, and partly because I really wanted to work with Marilyn Tellen because I thought she was also amazing, has done amazing research in the sickle cell field and has just contributed so much. So I think I knocked on her door a few months after getting to residency and was like, "Hi, I'm here. Do you have any projects for me?"
And she was like, I have all the projects for you.
Yeah, yep. And yeah, so she was patient with me and sat down, and over time we got to know each other very well. And she was a phenomenal research mentor and continues to be a phenomenal mentor and colleague and friend in every way. She is just a phenomenal person, and I'm so lucky to have her in my life. I worked with her on a project at Duke where I looked at kidney function. So I looked at in the Duke cohort how quickly kidney function was going down over time in adults with sickle cell and trying to find the risk factors that could lead to more rapid kidney function decline to see if we could identify patients who are at greater risk for kidney disease in the future and potentially intervene earlier. And so we were able to publish that work, and using those results, Dr. Tellen was then able to go and do further genome-wide testing and find additional genetic markers for kidney disease. And so I think that work was very fruitful and was really my next big exposure to clinical research, working with a large data set. And while I was there, was also, I guess, at Columbia and at Duke, was able to take biostatistics courses. So I had a chance to learn how to analyze my own data and work with data so that I could really understand what was going on. When you analyze it this way or that way, where do you introduce biases? Can you really trust this data? Do you really know what these numbers mean? And I think that helped me be more critical and a better scientist or clinical researcher in terms of making sure I can interpret what I'm seeing in the data correctly.
That's amazing. Wow.
So while you were at Duke, you have a lot of research going on and you're a sickle cell person at this point. Were you able to get into the sickle cell clinic during residency? I know that they have you doing a little bit of this, a little bit of that, but were you able to get that clinical experience too?
Yeah, I actually was able to, towards the end, set up a primary care sickle cell clinic. So I did rotate as an elective in the actual sickle cell clinic at Duke, but then we also, for patients who needed a primary care doctor, Marilyn and others, JJ Strauss and Nirmish Shah and Regina Crawford, were all at Duke and were wonderful mentors. And so they would refer some of their sickle cell patients to me as well. So I actually saw some of our patients in primary care context, which I think was also enlightening. And then we had also tried to set up a clinic for me specifically within the sickle cell clinic, but it was more challenging as a resident to be able to hold your own clinic, like specialty clinic, and then work abroad. It like wasn't able to keep anything longitudinal open.
It is a really important thing, though. I feel like as a trainee, you get a ton of inpatient sickle cell disease. But really, to become passionate about sickle cell disease, it's so important to be able to see patients when they're well and when they're thriving in clinic. So if you don't get that experience ever, you don't get to see the other side of sickle cell disease. And that other side of sickle cell disease is, I think, what makes sickle cell doctors. So I'm happy that you were able to get that experience along the way.
Yeah, no, I definitely agree. And I tell that to my residents and fellows all the time. The person in front of you is not, the person on their best day is not the person that you see outside in the world living their lives. If I were in that amount of pain, I don't want to see what I would look like in that hospital bed.
I feel like every step along the way, we're meeting new mentors and landing in great sickle cell places. After Duke, off to NIH for fellowship?
When I was trying to figure out where to do my international research, I tried to do my international research in sickle cell, but couldn't find a program that Fogarty, who is at the Fogarty International Center at the NIH, who was sponsoring my fellowship, had an affiliation with. But I, through that, trying to find a project, ended up meeting Russell Ware and Dr. Krish because they had attended one of the CAREST meetings in Jamaica, where I also met like Monica Asnani and Jennifer Knight Madden and some of the other big names in the field. And so got introduced to a lot of the global sickle cell community. And then ended up doing my research in Thailand in thalassemia, which is honestly great because having a strong genetic knowledge of thalassemia also, I think, is helpful with understanding hemoglobin disorders.
So many things in common with disorders of hemolysis.
Yeah, definitely. And then I worked with Rakasi, who is an expert in thalassemia. And then after that, I immediately transitioned to the NIH for more sickle cell work and research, specifically to work with Swile Fain at the NIH, who's very well known in the hemoglobin disorder field. And their sickle cell program is very well known. They're leaders in gene therapy with John Tisdale and haploidentical transplant with Courtney Fitzhugh. And they have a hematology clinical training program. So that's where I did my hematology. And small worlds, Swile and Vip know each other very well as well. I kind of basically met a lot of people in that sphere. But at the NIH, it was a wonderful community to be a part of. It was Arun Shet, Courtney Fitzhugh, Matt Shea, and John Tisdale, in addition to Swile. And I couldn't have asked for a better environment to continue my growth in sickle cell.
That's when I first met you. You were a fellow presenting a huge study at ASH, and it was amazing. That's when I was like, Amar, this is a future star in sickle cell. We need to be talking to Julia.
I remember that distinctly because you handled the Q&A like you had been in sickle cell for 30 years. And it was very impressive. But now, looking at the road you've been on, understanding how you met these really sickle cell avengers on your way to that point in time, it makes a lot of sense. It's just the best training and the best experiences that you're laying out here. We've spent so much time figuring out how you got to this point in time. We really should transition and talk about what's happening now. The culmination of all of that is something beautiful that's building in Pittsburgh. Tell us about what you're working on and what you're excited about in the moment.
I am an assistant professor of medicine at University of Pittsburgh. I am both on the clinical and the research side. I see patients in our adult sickle cell program, and I especially see a lot of young warriors who are transitioning over from our pediatric program over to our adult side. And for instance, a lot of them haven't had to think about sickle cell directed therapies because oftentimes their sickle cell hasn't been bothering them that much in their teenage years. And now as young adults, their sickle cell disease is changing and they have a lot of questions. They're frustrated that something that they knew so well is starting to seem unfamiliar, and they haven't heard too much about new treatments out there, but there are so many options. So I spend a lot of time talking with them and thinking about what the best treatment options are. And I think that's part of the reason why I focused a lot of my research on therapies. So I am working on some clinical trials for drug therapies in sickle cell. I don't work on the curative therapies, which are also very important, but especially as someone who's interested in making the biggest difference I can on a global scale, I am thinking about drugs that are either affordable or that patients in low and middle income countries are able to access. So for instance, one of my studies is looking at a combination of old drugs. Hydroxyurea is our mainstay of treatment in sickle cell, but some patients are still really anemic despite being on hydroxyurea. And so we've treated patients with anemia for a long time with EPO, which is a drug that we use in chronic kidney disease to raise their hemoglobin level. But we don't use it very often in sickle cell disease. There's not a lot of data for it. So I'm running a clinical trial to really better characterize this drug and how well it works and how safe it is in sickle cell disease. So that's one of my studies. And then I'm looking at some other newer types of drugs, for instance, pyruvate kinase activators in anemia in sickle cell. And you'll see like a lot of my focus is on anemia, partly because I think there's a lot of people working on pain, vaso-occlusive crisis. And I think that's really important because it really affects our patients' quality of life. But another part of their disease that can really affect quality of life is this profound anemia that some of our patients have, where they're tired all the time and it's hard for them to participate in sports and have the endurance to live the active lifestyle that they want, or have other symptoms of anemia. And I think the dogma in sickle cell in the past has been like, oh, that's just a part of sickle cell. As long as they're doing okay, let's just leave it alone. They're stable, right? And I guess I'm not one for dogma. I don't think there's great evidence to say that is okay. And I think there's increasing data to say that chronic anemia can have detrimental effects on organ function and definitely affects quality of life. And so part of my research is looking at what benefits can you get if you help improve the anemia in terms of heart function or kidney function. Or, for instance, another question we face is when you increase the hemoglobin too high in sickle cell, sometimes we worry about the blood getting too thick, blood viscosity getting too high. Really don't know how high is too high. And so as a reflex, we undershoot to play it safe, but then we're not really optimizing our patients, for instance, their quality of life. And so my research in the lab is looking at blood viscosity and other measures of red blood cell health to see what can we find in terms of an optimal balance. And is that something we individualize? Is your optimal balance different than mine? Does that optimal balance change if you're on hydroxyurea versus transfusions? And I'm hoping in this way to try to improve individual patients' symptoms and outcomes, and ultimately, hopefully, move us towards a more personalized model of care, what we have in other chronic diseases like heart failure and cancer, like using different drugs to really achieve the optimal outcome for each patient.
Yeah, this is so important. We've known for decades that anemia is associated with bad outcomes in sickle cell, and the worse the anemia, the more frequent those bad outcomes. And I think it's so important to generate this data showing that there are things you can do about it and they change those outcomes. What do you got going on in the lab? What are you working on?
Yeah, my research program at University of Pittsburgh is both on the clinical and the lab side. Overall, I'm focusing on the problem of anemia in sickle cell disease because I think it's a little bit overlooked. There's lots of different things that are important to look at in sickle cell, like pain, and there's a lot of organ damage. But one thing that drives a lot of these complications in sickle cell is the chronic anemia that our patients face. And so I'm tackling it from a few different perspectives. One is looking at different treatments. And so I'm looking at novel treatments that are still under development, trying to see if we can identify new treatments that might work better for our patients to improve the anemia with and without, our standard treatments. And then also interested in looking at combination therapy, because as we have more and more treatments available, we have to start figuring out how we can use these treatments that we have in combination so that we can find the best match or the best combination for each patient in front of us. And so one of my clinical trials also looks at a combination of two different existing treatments. And then aside from that, in my lab, I'm also doing some work in the mouse model of sickle cell disease, where we put the sickle gene, the sickle hemoglobin gene, into a mouse and use that as a model for testing drugs that we haven't tested in sickle cell patients yet to see if we get a signal that they might be helpful in patients, and testing another class of drugs in a mouse model to see whether we can increase their hemoglobin level and improve the iron overload that we see in the mice. So that's on the therapy side. And then I would say the other main focus of my work at Pittsburgh is really trying to understand what's going on with anemia in sickle cell. I don't think we have a great understanding of what increasing or decreasing hemoglobin really means in sickle cell at the fundamental level, at the blood flow or blood rheology level, despite this being a universal complication of sickle cell, because it's just so hard to study. Like, how do you visualize what's going on with your blood flow? And there's so many factors controlling a blood flow to each individual organ or tissue in your body. How thick is your blood? How deformable are your red cells? How much are your red cells sickling? How much blood vessel dysfunction do you have? How inflamed are your platelets and your white blood cells, and how sticky are they, and how much are they clogging up those blood vessels? So there's a lot of factors at play, and I'm looking at different types of tests in the lab as well as imaging tests that we can do in the clinic to give us a readout of some of these characteristics that we can then hopefully put together a more comprehensive picture of what's going on in the body when, for instance, we give you a drug and your hemoglobin goes up by a couple of grams. Is that helpful for getting more blood and oxygen to all of your tissues, or does it help in some tissues and not in others? And is there a point at which your hemoglobin is too high? We don't really know. So some of my work is finding these tests, or specifically what we call biomarkers, that can give us a sense of how an individual might be responding to treatments for sickle cell, and maybe also help us monitor how well the treatment is working and how safe the treatment is, and hopefully eventually help guide the development of new treatments. If these biomarkers work well, then we can use them in future clinical trials to say, hey, this treatment seems to be working better than this other treatment in terms of getting more blood flow to the brain. Maybe that's a benefit of this treatment. So I think at the end of the day, all of the research that I'm doing from the clinical side all the way to the lab side is really aimed at pushing drug development forward so that we can make more and better treatments available for our warriors.
That's amazing. And you can't do that just anywhere. I think Pittsburgh is a perfect place to do this. You've had legends there, Mark Gladwin and Greg Cato and still Enrico Novelli. And we've had Charles Joinasant on the podcast and just so much amazing work. Do you guys get together regularly and collaborate on stuff?
Oh, absolutely. We are constantly collaborating on all of our research. We have basically every week there's a sickle cell team meeting. We have a clinical team meeting. We have a administrative team meeting, a research team meeting, a faculty team meeting. We're just all meeting all the time. It really is a special place because I think it's rare to have a quorum of researchers and providers for sickle cell, both on the adult pediatric side. On the adult side, we have Dr. Enrico Novelli, like you mentioned, Dr. Laura DeCastro, Dr. Usola Oluwale, and then our psychologists. In addition to Dr. Charles Jonas Saint, there's also Dr. Lakia McGill, who recently joined. So we're really well supported, especially our adult team for clinical care. We do a lot of clinical trials, so our patients have access to different treatment options. And then we also have so many basic science collaborators working with us on the Vascular Medicine Institute side. People who really were honestly brought in by Mark Gladwin. He built this institute that really is focused on vascular medicine, blood disorders, including sickle cell disease. And they're able to help us do these mouse studies and studies in tissue culture and in blood cells and help drive a lot of the basic understanding of what is happening in sickle cell. And their research has led to the identification of some of these drug targets that we actually are developing drugs for today. So I think it's really important to have this collaboration between the clinical folks and the basic scientists. And we're lucky at Pittsburgh because we're located right next to each other on the same campus and we work together so closely, there's a direct, what we call bench to bedside translation of our science. And we're able to get these new scientific findings to patients more quickly.
I'm really looking forward to watching that unfold and all the great things that come out of there.
Julia, I recognize that we've talked so much about your professional career, but we would be remiss if we didn't touch on you outside of work. Dr. C, if I have your permission, I'm going to do with Julia what we haven't done with a guest in a long time, which is a little rapid fire.
Let's do it.
Rapid fire questions. Just lean into your instinct here. You ready?
All right, let's go.
All right. Coffee or tea?
Tea.
Cats or dogs?
Oh, dogs.
Sweet or savory?
I love the combination of sweet and savory together.
Ooh, okay. Okay. Texting or calling?
Texting.
Ice cream in a cone or a cup?
Cup.
Chocolate or vanilla?
Ooh, chocolate, but I really prefer weird or interesting flavors.
Okay.
Yeah, like the weirder, the better.
Breakfast or dinner?
Breakfast for dinner.
Early bird or night owl?
Night owl.
And if I opened up your Spotify, what would be your top 3 artists that you're listening to?
Billie Eilish.
Uh-huh.
The Weeknd.
Uh-huh.
Dua Lipa.
There you go. All right. There you guys go. Dr. Shu's not just sickle cell disease, hematology, and academic achievement. She is a real person with cool interests. Julia, I can't thank you enough for taking time out of your day to spend some time just catching up and talking about sickle cell.
Yeah, always great talking with you, Julia, and I think it's very clear why you're one of the rising stars.
Thank you so much for having me on. It was wonderful talking with the two of you and really appreciate you letting me share my story.
If you're a warrior out there hearing this podcast, please subscribe, like our episode, rate it, send us feedback, let us know how we're doing. And if you know somebody who could benefit from this podcast, send it to them. In the meantime, you could follow me at Dr. Z Sickle Cell.
And me at Imagineer.
Until then, take it easy. We'll see you next time. Peace.